Hello. Welcome to our weekly national news conference. I'm Sandy Close, Director of Ethnic Media Services. Hello to everybody. It's great to see so many friends join our call early. Today, we welcome the nation's premier federal agency tasked with monitoring the nation's health, the Centers for Disease Control and Prevention, the CDC. We are honored to host the first of 3 briefings with leading CDC experts who will provide the latest information on the COVID-19 pandemic and the vaccine rollout. The CDC is providing the same information for our briefing as they are at a simultaneous White House briefing in Washington. Our first speaker is Dr. Jose Montero, Director of the Center for State, Tribal, Local, and Territorial Support, who will provide the overview. Our second speaker is Dr. Laurie Hicks, Chief Medical Officer of the Vaccine Task Force. Thank you so much to both of you for speaking to us today. We ask you to speak slowly for our interpreters who are simultaneously interpreting in Mandarin, Spanish, and Korean. We invite reporters to enter questions in the chat box. We will moderate a Q&A session with our speakers after their presentations. We will send a video of today's briefing, expanded bios of the speakers, and important collateral information with links to data following the briefing. A word about CDC Director Rochelle Walensky, who was hoping to join today's briefing, but had a scheduling conflict. She hopes to join one of our subsequent briefings. Now I'm turning the conference over to today's moderator and briefing co-coordinator, journalist extraordinaire, Sunita Sarabji. Sunita.
Thank you so much, Sandy, and thank you to our reporters and our speakers for joining us today. As Sandy mentioned, we are joined first by Dr. Jose Montero. He's the director of the Center for State, Tribal, and Local and Territorial Support at the CDC. Dr. Montero, welcome.
Okay, let me see if I was able to work the technology. Can you hear me?
Yes, we can. Yes, we can.
Okay,
welcome.
good. So that's success number 1 for the day. Good afternoon, everybody. Good morning. It depends where in the country you are. I'm really great to be here, having this opportunity to talk with you. As said, I'm Dr. Jose Montero. I am the director of CDC's Center for State, Tribal, Local, and Territorial Support, which is the part of CDC that engages directly with the health departments across the country. I am really excited to speak with all of you today because I understand how integral you and your organizations are to this continued education and well-being of your communities. So let's dive in and discuss the state of the pandemic, the current state of the pandemic. Yesterday, CDC reported 33,000 new cases of COVID-19. 33,000 new cases of COVID-19. Our 7-day average is about 26,300 cases per day. This will represent an increase of nearly 70% from the previous 7-day average. So again, an upward trend. The 7-day average of hospitalization admissions is about 2,790 per day. Is an increase of 36% from the previous 7-day period. And after weeks of declines, the 7 days average daily deaths are now increasing. It increased by 26% to 211 per day. I want to provide some perspective about these numbers and how we should be thinking about where we are in the pandemic today. It is clear to many of us that this is becoming a pandemic of the unvaccinated. People who are unvaccinated account for a majority of the new infections, hospitalizations, and deaths. I want to emphasize that people who are unvaccinated account for a majority of the new infections, hospitalizations, and deaths. We're seeing outbreaks of cases in different parts of the country, especially those that have low vaccination coverage, because unvaccinated people are at risk. And communities that are fully vaccinated are faring way better than those communities that aren't. In the last week, we have seen a 10% increase in the number of counties at high risk and a 7% increase in counties at substantial risk. If you want to look at our data in more detail, I invite you to go to our website. There is something called COVID data tracker in the CDC website, and you can see data in your state and by county. Those counties where we have seen the increases correspond quite often to counties with low vaccination rates. When we look over time, we can put these increasing cases in perspective. And certainly that is what we are observing today. So again, as part of this context, back in January, we had an average 200,000 cases per day. The entire country was in a high level of transmission. I want to go back to the number that I gave them a few seconds ago. Yesterday, we reported 33,000 cases, and that is an increase from what we were seeing because our average increased by 70% in a week. So still is way lower than where we were in January, but we are going up. Because from January to June, it's clear that we made remarkable progress. The percent of counties with high transmission decreased. But as I have been trying to emphasize here, we have seen recent growth in cases in some counties. So well, we have to recognize that we are in a far better position than we were in January, February, March, or even April. It is quite clear that this pandemic is not over. The good news is that if you are vaccinated, you have good protection against severe COVID-19 and hospitalization. And you are protected against the variants that are circulating today in the country, including the Delta variant. So let's talk a little bit about the Delta variant before turning this to my esteemed colleague, Dr. Hicks here. So I am sure that you have been reading in the papers that you write and in the articles that you have about the Delta variant. We know that it's spreading rapidly throughout the country. We know that this particular Delta variant has increased transmissibility. That basically means that it can spread easily between people and is currently surging in pockets of the country with low vaccination rates. This week, we can tell you that the Delta variant is estimated to be the most prevalent variant in the United States, representing more than 57% of those samples that we sequence across this country. That we need to remember that a month ago in the middle of June, it was only 26%. So in less than a month, Delta variant went from 26% to 57% of those samples that we can sequence. So as I mentioned as well, the data suggests that the current FDA authorized vaccines that we are using here in the US, the Pfizer and Moderna and the J&J, offer protection against Delta and other known variants of concern. But to talk in more detail about issues on the vaccine, I will pass this to Dr. Laurie Hicks. Dr. Hicks.
So thank you very much, Dr. Montero, and good afternoon, everyone, or good morning, depending upon where you are. My name is Dr. Laurie Hicks, and I'm the Chief Medical Officer for CDC's Vaccine Task Force. And in my role, I oversee our work on vaccine safety, our independent advisory committee that makes the vaccine recommendations, and our guidance for doctors. And as Dr. Montero just said, we're seeing increases in cases in areas where people are unvaccinated. So we really want to reiterate that this is where we're seeing the most cases, in those places where people are unvaccinated. And I want to spend some time with you today to reiterate the importance of getting fully vaccinated. According to CDC data on vaccine completion, the good news is an extraordinarily high percentage of people in the United States who've gotten either the Pfizer or the Moderna vaccine are getting both of their shots, about 90%. And that's even better than the completion rates we have seen for other vaccines that also require more than one dose, such as the hepatitis and the varicella or the shingles vaccines. But I want to reiterate that the Pfizer and Moderna vaccines are most effective when given as 2 shots in a series. Both vaccines provide effective protection after 2 weeks after the second dose, with each exceeding 90% effectiveness against illness, including severe disease in the real world. Not completing the series puts those who are partially vaccinated at risk of illness, including the highly contagious Delta variant that Dr. Montero just spoke about. We know that getting vaccinated 3 or 4 weeks after your first vaccine may be difficult. But with the increased availability of vaccines nationwide, we really want to encourage people to get vaccinated on time. Additionally, it's important to know that you don't have to restart the series if you get your second dose late, even if it's after the recommended 3 or 4 weeks. So in other words, I've been saying to family members and friends, in other words, it's not too late to get your second dose to be considered fully vaccinated. Before we open the call for questions, I also want to direct you to CDC's COVID data tracker. Dr. Montero mentioned this as well. This data tracker has a wealth of data about how many people are getting vaccinated. We'll also send a link out to the tracker and some tips on how to interpret these data, especially the data on age, sex, and race and ethnicity. We know that certain communities, independent of geography, are also experiencing lower rates of vaccination. Although most racial and ethnic groups are demonstrating increases in vaccination, Black Americans continue to be under-vaccinated. We've added a new feature on the tracker that combines both vaccination data and social vulnerability indicators as measured by CDC's Social Vulnerability Index. Now, I wanted to just mention, when we talk about vulnerability, we're talking about things like gender, population, age, education, social and economic status, and access to medical care. So this map provides visualizations of how county-level vaccination coverage by county-level social vulnerability varies throughout the United States for the total population and also for different age groups. COVID-19 vaccination is our most effective strategy, without a doubt, to prevent infection and control the COVID-19 pandemic. We encourage you and the audiences that you reach to get vaccinated yourself, your family, and for your community. If you're not vaccinated yet, you remain at risk. We are going to continue to see preventable cases, hospitalizations, and sadly deaths among the unvaccinated. So if you haven't done so yet, now is the time to get vaccinated. Thank you very much.
Thank you to Dr. Hicks and Dr. Montero. Before we open the call up to questions from reporters, I'd like to ask a couple of questions of both of you. Dr. Montero, you talked about the surge in new cases that were reported yesterday, do you believe that we are already in the midst of that third wave that was anticipated?
So I don't know if I want to categorize that as we stand in today, but it is absolutely clear that we are on the upswing of these of the numbers. We clearly see an increase in cases. We clearly see an increase in hospitalizations, and we're starting to see an increase in fatalities. Now, that is the data for the country. But if you start to look at this state by state, you are going to see big differences. So Dr. Hicks highlighted as well the COVID data tracker. Look at your own states, and you are going to see the differences across the different parts of the country. Time will tell us if we are in that wave or not. But clearly, we are at a place where we are going up, and we do have an amazing tool at our hand that will dramatically change that, and is the vaccine. We saw that early on. As soon as we started the vaccination, we saw the dramatic decreases in mortality in populations over 65, 75, where we started, and we have seen the change. We need to complete the task. We need our population to be vaccinated.
Absolutely. Could you characterize the metrics that might establish that third wave by the CDC?
Can you say that again? Sorry.
Could you characterize what might constitute a third wave? When will the CDC say we are in a third wave? What are the characteristics that would...
I don't have those indicators with me right here, but they are tied to a continued increase. Most of the time, the definition of we are in the third wave is done retrospectively. We see the trends. As I said, we know that we are going there. We still have an amazing tool that can help us change that and never get into it. We need to continue to talk about the vaccines.
Absolutely. In March of 2020, we understood that there were going to be health inequities in addressing our response to the pandemic. And I wonder, 18 months later, do you think that we have addressed those health inequities adequately? I asked this question to both Dr. Montero and Dr. Hicks. Dr. Hicks, you mentioned that Black Americans still continue to be under-vaccinated. So perhaps you could start?
Sure. So I think one thing that we really need to do, and this is an area of focus for CDC right now, is ensuring access and equity in terms of getting vaccines into communities, making sure we're generating the demand for vaccine, and then also targeting those hotspots where we're seeing a lot of transmission. So key goals to expand to places where people can get vaccinated and shift to broad coverage, places like making sure that primary care physicians have access to the vaccine or able to deliver it, vaccines for children providers have them, school-focused programs. We're really working also on increasing vaccine confidence and partnering with a number of different trusted advocates. We also know that providers are our patients' most trusted source of information on vaccines. So we want to make sure that providers have the information they need to educate patients. And also peer-to-peer promotion is another approach to try to reduce some of that hesitancy and reduce some of the inequities that we're seeing. And CDC is also working with a number of different medical associations, community clinics, faith-based organizations, really to get into those communities. And this includes support for the National Resource Center for Refugees, Immigrants, and Migrants, which is working closely with community partners to address COVID mitigation and vaccination efforts in that population. Over to you, Dr. Montero.
Yeah, perfect. Thank you. So let me add a few things there. So in your question, if we are doing enough and if we have changed it, historical wrongdoings don't get corrected overnight. And it will take time for this country to be able to have us all in the same level at the same equity level that we will all aspire to. When we started the pandemic, we saw that some professions and some groups got hit harder. Those people who work in the one-to-one industries, service to the clients, or had work sites where they were all together. So industries in the agricultural field or some productions were presenting cases at higher levels. That's why we emphasize with many of those populations today, they need to vaccinate so we solve the issue. But at the same time, we are working with the health departments and across different parts of government to address many of the things that are behind that. There are issues of access, there are issues of education, there are issues of trust. And Dr. Hicks mentioned before how we have identified trusted messengers. We see that African-American groups or Hispanic groups are behind in vaccines, and they have, especially African-American populations, historical wrongdoings and reasons for trust that we cannot deny. But we have a pandemic. So we are not going to change all of that overnight. But we are certainly working, and CDC is developing right now a lot of science components on the science of disparities. Our director has been talking about a core initiative that is helping us all at CDC across all programs, because it doesn't apply only to COVID-19 to address disparities. In the center that I am the director, we put out 2.25 billions with a B. I know that in my accent, you may think that I said millions. No, I said billions with a B for social disparities in populations that have less access and have health inequities. That means that we are trying to reach out to rural populations, populations in the outskirts of the big cities that don't have the same level of access and care and have suffered historically some of these issues. So there are funds out there to make these changes. It will not happen overnight, but with the vaccine, our team, the vaccine task force, is making an amazing work trying to reach out to those groups so we can protect them.
Fantastic. I would like to next ask my colleagues, Pilar Marrero and also Sandy Close, to ask a couple of questions. Pilar.
Yes, thank you, Sunita. Thank you both for being with us. And this question is for either of you or both who wants to answer it. A pandemic of the unvaccinated sounds like mostly it's the unvaccinated who are affected, but this isn't true, is it? The reality is that unvaccinated people are creating the new infections, the new surge. They are likely to create more variants for the rest of us who are vaccinated and who may actually have breakthrough infections thanks to them. So why aren't we saying that? Why aren't we saying the unvaccinated people are not only affecting themselves, they're putting everyone else and all the gains that we've done in peril?
Thank you very much for that comment. You are absolutely correct. It was never our intent or my intent when using that term to say that only unvaccinated people are getting sick or impacted. I think that I specifically said the majority of the cases currently are in that population. But you are highlighting the core issue is that it doesn't get restricted to people who feel that I am not going to be sick or I'm not going to be severely ill. From there is where it expands. And that is what is changing the dynamic in many counties around the country. So that's what I highlighted, that a few counties that were not at high risk are changing because they are they are the place where things spread out. And it worries us a lot that some segments of the population are unvaccinated because maybe in some groups, they are the ones who are going to have access to our elderly. They may be taking care of that elderly, and that is where we are going to see breakthrough cases. So you are correct in rounding the term and the concept. So thank you for that.
And just to add to Dr. Montero's comments, I absolutely agree with everything he said. That there are certain populations who can't get vaccinated yet, right? So we have the under 12 population in the United States who can't get vaccinated yet. And so obviously our children remain vulnerable, especially if transmission is high. And so that is another population that I'm very concerned about. And appealing to parents, I think, is a really important step to try to make sure that they're getting vaccinated in order to protect their kids. And then the other part of this story that I think we need to be talking more about is the immunocompromised populations. So even in those populations, even if they get vaccinated, may not have the same level of protection as someone else who's not immunocompromised, who's vaccinated. And so it's really up to us to figure out how do we protect these individuals who are at high risk for severe complications from COVID, even if they're trying to do the right thing and get vaccinated. And so making sure that the individuals that they're getting exposed to those individuals are getting vaccinated is a really important step. And then you may have seen that some organizations like the Society for Healthcare Epidemiology of America are moving forward with statements, very strong statements about vaccination of healthcare workers and making sure that a higher proportion of the individuals serving these vulnerable populations are getting vaccinated as well.
That's sweet. Thank you, Dr. Hicks and Dr. Montero. I'm going to open the call up to questions now from reporters. Henrietta Burrows kicks it off. Henrietta.
Thanks so much, Sunita. Dr. Montero and Dr. Hicks, neither one of you has mentioned the wearing of masks, and yet it's been shown that masks can be a very important tool in preventing the transmission of the virus. So why is there no mention now by the CDC of wearing masks? Why has the CDC seemed to have pulled back from any reference to masks whatsoever?
Yeah, I think what we can, this is Laurie, I'm happy to start, and then Dr. Montero, if you want to add. I think that masks are extremely important, and preventive measures are still very important, particularly in those people I just spoke about. So children under the age of 12 who are unvaccinated, persons who are immunocompromised, who even if they have been vaccinated may not actually be fully protected against COVID-19. So I absolutely 100% agree with you that we have opportunities to still promote the other preventive measures as well. Masking is one of them, social distancing is another, making sure you're avoiding crowded places, especially indoor, poorly ventilated spaces. If you're unvaccinated is advised. In addition, some of us have decided that we still, even though we're fully vaccinated, have just chosen to continue those extra preventive measures. And I'm one of those people. When I go to the grocery store, I still wear my mask. And I think that message needs to get out there, that, the permissive recommendation to remove your mask is just that. If you want to remove your mask, it's considered safe to do so. But if you prefer to continue wearing a mask in places where you may be around unvaccinated individuals, that is absolutely, it's totally acceptable and your decision to do that. So I think we need to be a little bit more open in our discussions about masks and the opportunity for prevention.
So, Laurie, if I can build on what you just said, I am with you. I was vaccinated months ago, and when I go out, I put on my mask. I went to visit my mother in Colombia, and I use my mask all the time because the situation there is way different. And I want to highlight that part because what people may have not heard correctly in our recommendation about the mask is that it may be incumbent upon the local or state authorities based on their epidemiological situation on the region to recommend or mandate the mask use. CDC still has clear recommendations for masks in some settings. We are still talking about what happens in homeless shelters or correctional facilities. So the message is not black and white. And that has been one of the most complex things around this pandemic, that messages are not always black and white, and that they evolve based on the stage of the pandemic where we are at. A year ago, we didn't have vaccines. Today we have them. We know that the vaccines are good, so we are protected. We can be around most people without any risk, but we can use the mask if we want to. If I live in some particular counties, I will use it all the time if I am outside, because vaccination rates there may be 40% only, or things like that. And as Dr. Hicks mentioned, when we're talking about schools in our new guidance, we made some specific recommendations for some use of the mask there as appropriate under different circumstances. So please don't say that CDC says don't use masks, because we never said that. We said that with the vaccines that we have today in the US, those of us who are vaccinated have good level of protection, but the mask has a value in some particular settings, and local and state communities will be able to decide if, based on their epidemiology, they need to do something different.
Absolutely. Our next question comes from Peter White. Peter.
Hi, everybody. Thank you, doctors, for being here. Some of you probably know this. Just this week, Monday, this week, the head vaccination person in the Tennessee Department of Health was let go without explanation. It's a big flap. It's big news here. So I don't want to take up everybody's time, but I think the question I asked could be useful to other reporters besides me here in Tennessee. This woman who was fired was like, you know, a real vaccine champion. Okay, she was, and so, and this is a red state, and a lot of the comments that I'm hearing are like, yes, this population is at risk, and this and that. Look, the problem is not the populations that are at risk. The problem in places like Tennessee is that you have a trifecta of reactionary, really ignorant people running the show. And they're firing like the vaccine expert, right? So my question is, the numbers that we have here on the Delta variant in Tennessee don't seem very high, but I also understand it takes 5 weeks to sequence them. So my question, I have two parts of the question. First question is, who sequences the samples? Is it the state health department labs, or is it you people in Atlanta? That's the first question. Do you want me to stop, or should I ask?
Yes, please, Peter, because we've got about 13 questions. So if you could ask that question and then.
Okay.
So sequencing is done in many different places. CDC has capacity to do sequence in-house, but many state health departments do too. Actually, we have funded health departments across the nation to develop that capacity. And we did create a network of partners, which includes academic centers, to have a booster on that capacity for sequencing. So sequencing is done in many different places across the country. Dr. Hicks, I don't know if you want to add.
No, that's absolutely correct. But I think what you're pointing out is that we really need this must be a cooperative effort with all partners, including policymakers, and so we need to have everyone on board in order to really make this to make our prevention measures effective. When we're looking at the map right now, and we map out the counties where we have really I would say low coverage in vaccination rates, that is where we're seeing what I would consider kind of the fires starting to pop up with this new variant. It's not the counties where we see high vaccination rates. So what we're trying to do is sound the alarm a little bit to some of these jurisdictions where vaccination rates are low, to really engage both the public health community, the clinical community, but also our policymakers to really identify, the opportunities here to prevent what we consider the forest fire that we're seeing in some of the low vaccination locations from spreading to these other states where vaccination rates are quite low.
And Peter, you had a
this issue that Dr. Hicks mentioned is quite important. We the people, are tired of the pandemic, right? We have been at this for a year and a half. We don't want to be tested. We don't want to do this. We don't want to do that. But the reality is we need to continue to be tested. And especially in those areas with low vaccination rates, we need to have a more engaged and active testing approach so we know what's coming up and maybe identify early on those asymptomatic people who may be able to transmit and trigger outbreaks. So again, it is a complex issue that requires us all to engage. From, yes, our elected official, us as the technical people, but us as members of our own communities, knowing that, yes, we need to be tested. Of course, it will be better if we are vaccinated, but all of this is a comprehensive effort. So there.
Thank you. We next go to Don Tagala.
Wait a second. I have a follow-up. It's important. Can you hear me?
Okay. Yes.
So, okay, I just want to emphasize here, the problem is that you're not going to get any partnership with the state health officials in Tennessee. They have stopped all outreach and information about getting the vaccine to teenagers as a political position, really. And so my second question to you about the CDC is, you guys are in charge of everybody's public health in the end, right? Do you have the authority to say, hey, Governor Lee, you can't do that. You can't block information to the teenagers and their parents about vaccines and how to get them and the advocacy and all the rest of it, which is what's happening here.
Our role as federal agencies is to, under our federal system, and federalism is the fabric of our nation. The states are autonomous in many of those decisions. We are all the time providing the right type of advice and direction to those elected authorities in all jurisdictions around the country. As a totality of government engaged on a response at different levels, we have meetings with the health directors regularly every week. We have meetings with the elected officials every week or two, and they get briefs and briefings with direct information from our experts. And then they make the decisions that they made. And I will leave it at that.
Thank you. We're going to move on to Oni Advincula. Oni?
Hi, Sunita. Thank you very much. In our building last week, 3 residents, all of them were vaccinated, were tested positive for the Delta variant. So my question would be, while we are focusing on the unvaccinated, what should be the message of the CDC for the vaccinated population, considering it's almost 67% of the American people at least get 1 dose? And what is these people, what is the most concerned about, that these people should be most concerned about? Just wanted to get the message from the CDC for those vaccinated as well.
Yeah, I actually think that the message for vaccinated people right now is one of reassurance, because there have been a lot of questions about whether individuals need extra doses of vaccine or booster doses, but we're not seeing that in our data right now. And we're tracking the data on vaccine effectiveness, breakthrough infections, and the severity of infections in both vaccinated and unvaccinated populations. And the vast majority of people who are landing in our hospitals and dying from COVID right now are people who are unvaccinated. So I really think that that's the message that we need to convey, is that if you're vaccinated, you are most likely protected. That doesn't mean that you shouldn't continue to take caution. If there are circumstances where you're concerned about being around people who have COVID. Right now, we are very, very closely looking at this Delta variant. So far, we are not seeing a signal in our data that indicates that individuals who are exposed, who are vaccinated, are getting, I would say, routinely getting severe disease. And occasionally we do see breakthrough infections, but the vast majority of our breakthrough infections we're seeing in vaccinated persons are really mild or even asymptomatic. And so I think that is the communication message that I would share with your vaccinated population. You know, if you're in a building where people are unvaccinated and they're getting infected with the Delta variant, those people are much more likely to, one, of course, get infected in the first place, and two, go on to have a severe outcome related to the virus itself. The really impressive data, I would say, have, in terms of preventing hospitalizations and deaths, have been really reassuring lately when it comes to all the variants that we're seeing in circulation right now. Again, we'll continue to monitor very closely, but right at this point in time, I would say we really just would encourage folks, if they haven't completed their vaccine series, to go ahead and do that, and for folks to get vaccinated if they haven't initiated their primary series.
All right, we move on next to Don Gala. Don, could you introduce yourself and which media outlet you're from? Don? All right, then let's move on to Eugene Levin. Eugene?
Mute. Thank you very much, doctors. I have a question. Will booster be required to be done by the same production company that original vaccinated? And it's related to the issue that the new restriction, and we have here in Los Angeles, it's Panorama Media Group, a major Russian media group. In Los Angeles, the new restriction will bring more anxiety about virus and its effect on the mental health of ethnic population. People ask about absolute transparency regarding Delta. At the same time, they're asking, will required be done by the same company that it was original vaccinated?
So I think your question is whether if boosters are going to be indicated, which right now we're not seeing any indication that we'll need booster doses, but if they will be indicated, will it likely be the same companies or manufacturers who are providing our current vaccines? One thing I can say is that we are actively preparing for this. A lot of the operationalizing of getting vaccine produced and ready for distribution in case we need it is underway. And those plans are underway with the current vaccine manufacturers who have distributed the current, what I would say, FDA vaccines that are currently under emergency use authorization. So you may have seen that Pfizer is preparing for booster doses, but what I understand is that it would probably be, if we were to have a booster campaign or need for boosters sometime later this year, we would likely be using the same vaccines that we've already been using.
Thank you. And how long PCR test will be required for travel?
Yeah, I don't know the answer to that. Do you know, Dr. Montero?
While we continue to see outbreaks and new variants coming around the world, we will continue to look at testing as a good strategy for us to determine what our own risk is. So we don't have an end date, because it's one of the tools on the portfolio that we use, and it is applied based on what's going on around the world.
Thank you.
Thank you. I'm going to ask Don's very important question. His mic is not working. How can the coronavirus be prevented from mutating or evolving into variants? Is it in that way, will it be the same virus throughout? And is this even possible? Dr. Montero, did you want to take that question first?
If I understand correctly, he's asking how can we stop the mutations?
Exactly.
So getting everybody vaccinated so there is no more wild transmission of the virus. While a virus or a bacteria is out there circulating, it has the time to evolve and change. And nature is incredibly wise, right? So what the evolution of those mutations in the virus do is allow them to jump easier every time to a new group. You have seen how antibiotic resistance gets developed. So the best thing that we can do is vaccinate everybody. And that stops transmission so the virus doesn't mutate. And I lost my connection.
Dr. Hicks, did you want to add to that?
The only thing I was going to mention is that this particular issue really highlights how important this is on a global scale to make sure that there is also equitable distribution of vaccines globally, because the truth is a variant anywhere is a variant everywhere. Because as you can see, the variant started out in some of our European countries and other countries. Israel is seeing a lot of the Delta variant now, and very quickly we now have Delta variant in the United States. So I think that's the point. We really need to be thinking about not only improving vaccination rates and expanding to populations in the United States, but we also really need to be thinking about how do we tackle this on a global level so that new variants don't continue to emerge.
Thank you. Araceli Martinez is next. Araceli, could you introduce yourself?
Hello.
Yes.
Sunita?
Yes.
Thank you. Hi. In many job sites like school, daycares, and even health clinics, there are staff like teachers and caregivers that don't want to get the vaccine, and they said that they cannot be forced to take it, and unions are supporting them. How can we get out of this pandemic when there are many people that don't want to get vaccinated? Even some California legislators don't want to take it. And I would like to have your input on this. And also, is there a chance that those with the Johnson & Johnson vaccine could get an extra shot from Pfizer or Moderna in order to be more protected? Thank you.
So I can answer your second question pretty quickly. We're looking at the data right now on whether or not the Pfizer, there could be kind of what we call a mix and match of vaccines. So if you have a J&J first, can you get a Pfizer vaccine or Moderna vaccine second? There's some data coming out of Europe to suggest that may be a reasonable approach. We've seen some data on the AstraZeneca vaccine and mRNA vaccine from Europe that suggests that mix and match does lead to good protection. I would say that we only have a small number of studies right now and very limited data, so that I don't think we can necessarily move forward with a recommendation or guidance here to do that. But we are looking closely at that possibility of a mix and match, and which combinations would be both safe and effective. And so that's the key question: is we have to make sure the safety issue is being monitored very carefully, and then we also want to make sure that actually mixing and matching would be just as effective as giving 2 doses or a single dose of the J&J versus the mRNA vaccines.
Thank you. Julia Najib is next. I'm sorry, Julia Dudley is next.
Sorry.
Did you want to?
The first part of the question about mandates and vaccination, you have seen strong statements from many different medical organizations recommending that people who are in healthcare and some other key industries get a mandate for vaccination. Many private businesses have opted to do that. And as you may have seen, many different healthcare facilities are opting to do that. And that's the place where we are at. There is no standardized mandate. And some organizations are moving into that space, filling that space. Thank you. Sorry.
Oh, yeah, no, thank you. Thanks so much. Go on, please.
I was just going to say the state of Rhode Island has moved to require that all of their institutions of higher education will require vaccines. So again, this is I would say a jurisdiction by jurisdiction decision, and often a facility by facility decision. But I also think as time goes on, the social acceptability of not being vaccinated that will decrease as more people get vaccinated. If you're unvaccinated, I think there will be pressure to do so. So I'm hoping that peer-to-peer pressure might actually help with some of that.
Thank you so much. Julia, you are next. Please introduce yourself and your outlet.
Sure. Thank you. Julia Dudley Najib, ONME News. I'm located in Fresno, California. I represent the Central Valley. I'd like to thank you, Dr. Hicks and Dr. Montero, for coming on and speaking to us today. I have several frustrations as a media person that represents the African-American community. We are continually seeing an uptick in people's different side effects that are happening, and they're not sharing the information. And this is happening specifically, I can speak for the Central Valley, and I can also speak for the Bay Area, where I do get the phone calls or the text messages. And so that information is getting spread amongst our community, and they're not reporting it on the VAERS system, but I noticed that on the VAERS system, the CDC doesn't really promote that or address that. And so that messaging is not working in our community. Feeling that you're not a part of the in crowd if you don't get vaccinated, not working. Part of that is part of the historical nature of what has happened to African Americans in this country in regards to what has happened to them medically, where they were confirmed by doctors and the like and so forth. And in return, they got syphilis, or in return, they were sterilized. So that messaging is not working. How can you help us change that narrative, or begin to look into the side effects, or help people feel comfortable about reporting it? Because that's another thing, they're not reporting their side effects. And these are personal individuals that I know who have called me or I have learned about, and it is really disconcerting, and this spreads among our community by word of mouth. And thank you, I'll take my answer muted.
Yeah, so I'll first comment on some of the safety communications, because I think one thing that is really important to note, and I think we really need to be more vocal about this. I think because the vaccines are still under emergency use authorization, a lot of people believe that there may be some concerns, or that there's been a rush or something like that. We've heard a lot of concerns about these vaccines and the rollout. But what I would say is these vaccines are under the most intense scrutiny of any vaccines we've ever rolled out in any vaccine campaign in history. And I think that's something we really, really need to communicate effectively. And I'm open to hearing your suggestions too on how we can do better on that front. I mean, with any vaccine or medication, there are always the potential for side effects or adverse events. And we are seeing a few safety issues with these vaccines, but the safety issues are really, really rare comparative to the number of cases that we're preventing in terms of COVID disease, hospitalizations, and deaths from COVID. So clearly the benefits have been outweighing the risks, and those discussions have been happening very publicly with our advisory committee in immunization practices. And so we continue to have those public conversations whenever there is a safety concern. What I would like to ask you is, what do you think? I'm interested in hearing what your thoughts are on what we can do better to reach African American communities and really message around the safety. I mean, I think very sympathetic to the concerns of that community, and really want to hear what your thoughts are on it.
Thank you. I was waiting to be unmuted.
Oh.
So I think, Dr. Hicks, that the biggest issue would be addressing their side effect concerns, because they're seeing their neighbor get for instance, the paralysis, and that lasted for several weeks in one individual, and people were mortified. And then that spread, that word. Another individual ended up hospitalized. But again, we didn't know what those prior conditions were. And I think having a sensitive ear just to the side effects and helping people to understand that this emergency use authorization is still under scrutiny, I think that's going to be the key. Because African Americans are not stupid, and people keep saying, just get vaccinated, and they're not trying to hear that, because in their mind, well, wait a minute, I just saw Shelly over here has paralysis, this person's over here in the hospital, and this is what's happening around me, just in my circle of people that I know of. And so a lot of them have only taken the first shot. These are very smart people, these are educated people, these are people with degrees, and most of them are scared to death, doctor. I'm just telling you the truth as I know it. So if there's a way to start addressing that, and like you said, really look at the scrutinizing effort and what goes to that scrutinizing process for this emergency use authorization, because that's all they hear. Well, if this is emergency use authorization, then we're being used as the test dummies, and I don't want to go through that syphilis experiment again. I don't want to go through that sterilization experiment again. And that's what's happening. Thank you.
Thank you, Julia.
Thank you.
That was really informative. I appreciate it. Last question is from Khalil Abdullah. And then I would like to ask each of the speakers to maybe give a brief 30-second soundbite on the most important message they'd like to present of this hour-long conversation. Khalil.
Hello. Am I audible?
Yes.
Yes, okay. Quick note. Okay, quick note. Maryland governor, I live in Maryland, made an announcement that of the 100% of the people who died from COVID during the last month, that total population was unvaccinated. So that's just a quick snapshot. And Julie and I can go and have our conversation otherwise. But I have a question about the scientific reason why children under 12 cannot be vaccinated. I mean, we're looking at a case, I know of a case personally where a 12-year-old child contracted COVID. What do you do with that population? You know, parents are mortified, scared to death about sending their children to school, back to school, the under 12 population. And the other thing I wanted to ask, which I'm really curious if you could explain the scientific metrics of how you determine the speed of transmission, because last week we heard from someone who said you can get the variant within 5 seconds of walking past somebody in a shopping mall. So how do you measure the speed of transmission? How do you measure that? Okay, that's my question.
Dr. Montero, do you want to take that?
Oh, I was going to defer to Laurie so a couple of things with children. Any pharmaceutical product needs to be approved by the FDA. Right now, they are doing a lot of studies of the efficacy and safety of the vaccine in other age groups. And when those studies are finalized, FDA reviews that. They have an independent panel that will do a first step. Then they get to approve it. And when it gets approved, it comes to CDC for a recommendation of use. So it's not that we are saying that the vaccine doesn't work. It's that we are doing what we are expected to be doing, which is get this to be a safe process. And that is where the stage that we are at with vaccine for children under 12. Other vaccines that Pfizer has been approved for anybody over 12. The other companies have to submit the data, do the same studies, and request the same approval. and I think that they are in the process. But that's the difference between and why not all vaccines are recommended for all ages at this stage. Laurie, do you want to correct me?
No, you don't need to be corrected at all, but I thought I would just add a few comments to your excellent comments. So one of the keys here is that the companies are looking at the dosing for children, because you may know or you may not know that the current vaccines that we're using, every single person from the 12-year-olds all the way up to the 90-year-olds are getting the same dose of vaccine. And so in the very young, obviously we have to think about whether the doses that we're using are appropriate. So right now, these companies are looking at different doses to determine which dose will lead to the most protection, and also looking at the safety profiles of that as well. And so once we have those studies looking at the dosing, I think what you'll see is that we're going to have the opportunity to vaccinate the under 12 population.
Excuse me, real quickly. How do you do a clinical trial on 12-year-olds? I mean, where are you getting your data from? Where are the children that you're using to get the data? You're just going to do data based on calculations of a lesser dose?
So what happens is the children are enrolled in clinical trials the same way the adults were, and I would say the dose of vaccines are, the kids are randomized into different groups so they could get a 50, the half a dose as opposed to like a higher dose. And so some kids will get slightly lower doses and some kids will get slightly higher doses, and then they'll compare the outcomes in those kids, I would say, both from like measuring samples of blood and looking for immune response in the blood, and then also looking for disease in those kids as well. So yeah.
Okay.
Those kids are recruited as volunteers and they have to have parental permission. So
yes.
There is a whole ethical process to guarantee that nobody is abused or mistreated in any of these clinical trials.
That's correct.
I just wanted to leave time for Sandy to ask a question. I know we're running out of time,
Yep.
but last question from Sandy, please.
Okay, there's so many great questions on the chat, but this is from several Korean media. Recently, the FDA warned that J&J vaccine has new side effects called Guillain-Barré syndrome. And some Korean Americans are afraid of the new side effects because the Biden administration donated over 1 million doses of J&J to Korea and Japan. Can you update about the side effect of J&J? Thank you so much. And that will have to be our last question. And thank you for staying on for 2 more minutes.
Yeah. So I'm happy to provide an update on the safety signal we've been seeing with Guillain-Barré syndrome. So as of July 12th, more than 12.8 million doses of the J&J vaccine have been administered here in the United States. And CDC has identified about roughly 100 preliminary reports of Guillain-Barré syndrome. Guillain-Barré syndrome is an illness, a neurologic illness that can lead to muscle weakness. So it's certainly not an insignificant side effect or adverse event. Most people do fully recover from Guillain-Barré syndrome, so that's important to note. But some folks do have lasting effects. So I think the important thing to really understand here is again, we look at the benefits and risks. There really isn't any medication or any vaccine that doesn't have the potential for side effects or adverse events. But when we're talking about 12.8 million doses of vaccine preventing thousands and thousands of cases of COVID-19 leading to hospitalizations, severe disease, and death, then we have that benefit versus this what we consider a rare adverse event. So again, it's something that we want everyone to be aware of. But we know now, but we have had discussions with many of our partners on this. I would say next week we are having an advisory committee meeting on from our ACIP work group. So next Thursday, June 22nd, and we will have some outcomes from that meeting on, I would say, guidance related to the J&J vaccine after that meeting. So I would say I recommend staying tuned, but I would say generally speaking, when we are looking at the benefit and risk, the benefits of vaccine are still outweighing the risks, and vaccines are still recommended for everyone 12 and older.
That's terrific. And we're 5 minutes over time. Sunita, we better let people go, but thank you very, very much. It was just tremendous to have this opportunity to ask questions and share concerns and hear experts address them. Thank you, Sunita. Thank you.
Thank you, everyone.
Thank you. Muchas gracias. Shay Shay.